Hi, I'm Sarah Ozel Shore. I am a psychotherapist and clinical trainer. And today I want to talk to you about assessing regulation in real time. Specifically, what should a clinician do when they recognize that a client is producing insight but lacks the conditions to integrate it? In the previous videos, we talked about how insight is often state dependent, and that if we can assist our clients in returning to a state of regulation more frequently, insights have a better shot at being integrated, meaning that the client can use the insight as they progress through their treatment, and they actually um, have some kind of psychological change or reorganization that sticks. So, the question today is, what should a clinician do when they recognize that a client is producing insight but lacks the conditions to integrate it? The first thing you want to do is resist the pull of the insight itself, which is genuinely difficult because when a client produces something that sounds significant, the natural clinical impulse is to follow it, to deepen it, to elaborate on it, and to help the client stay with what they've just found. And if the conditions were present for integration, that would be exactly the right move. But when the conditions for integration aren't present, following the insight deeper is actually likely to produce more insight sounding material without actually increasing the probability that any of it will hold or consolidate. So you end up with sessions that are full of apparent movement, maybe even excitement, but produce very little lasting change. What to do instead is attend first to the regulatory conditions that are present in the session. Slow the session down, reduce the cognitive and emotional load, create more space, literally, more silence, more room for the client to actually be with what is emerging rather than producing commentary on it or doing anything with it. In some cases, it's worth naming directly and simply what you're observing, stating, I want to stay with that for a moment before we go further. Not as a technique, but as a genuine clinical intervention. That space is what creates the conditions for integration to occur. And in subsequent sessions, it's worth building bridges deliberately, returning to what was found the previous week, not to re-explain it, but to help the client reassess it and re-access it and hold it again. That's practicing integration. Because integration is not an event that happens once, it is a process that occurs over time across sessions. And as the same territory is revisited from slightly different angles under slightly different conditions, we're elaborating on the insight. And the clinician's role is to support that process, which requires recognizing when integration is and isn't available and calibrating the work accordingly. The distinction between insight and the capacity to integrate insight is one of the things the clinical discernment framework is built to address, specifically through Gate 1, which is regulation, and Gate 5, which is symbolic and reflective capacity. If this resonates, I hope you'll join me for a webinar I'm offering over the next few months. The first one is on May 15th, and you can find the link at my website, sarahozelshore.com. I'm Sarah Ozelshore. I'll see you next time.